Pay close attention because what I'm about to share could represent the most significant Social Security transformation we've witnessed in over 10 years. Without any advance notice, a groundbreaking decision has been made that impacts every single payment going forward. The Social Security Administration has just implemented a lasting increase, and countless Americans are waking up today wondering what's changed, what triggered it, and crucially, how much additional money they'll be receiving. Text messages started flying, banking apps started lighting up, word began spreading like wildfire from coast to coast. Some recipients are reporting they've already noticed a modest increase in their upcoming payments. Others are hearing from neighbors that the adjustment exceeds what anyone anticipated. And today, for the very first time, we can break down precisely what this development means, why it's unfolding at this moment, and what your revised payment might be. This is not your standard cost of living adjustment. This is not a temporary fix, and this is not another empty Washington pledge that disappears after the news cycle ends. What transpired over the past day is extraordinary, it's unprecedented, it's momentous, and it touches every individual who relies on Social Security, supplemental security income, Social Security disability insurance, survivors payments, and disability support to make ends meet each month. Here's what has everyone scratching their heads. There was no grand unveiling planned, no media briefing on the calendar, no insider tips to reporters. But late yesterday evening, tucked away inside a bulletin from the Social Security Administration, one crucial sentence validated something virtually no one saw coming. A revised calculation method has officially gone into effect, a method that permanently elevates payments for existing beneficiaries and everyone who will retire in the years ahead. Why at this particular time? Why during this week? And why did the SSA proceed quietly rather than orchestrating a major public announcement? That's the question everyone's asking this morning. But as we examine the paperwork more closely, the situation becomes clearer. Advocacy organizations for older Americans have been sounding the alarm for years that the existing calculation failed to capture reality. They insisted that grocery prices, housing expenses, energy bills, and healthcare costs were climbing faster than the government's measurement system acknowledged. And for the first time, both legislators and Social Security officials listened. What comes next might catch you off guard. In just a minute, I'll explain exactly which recipients see the increase first, how substantial the adjustment truly is, and why specialists are declaring this the most consequential Social Security reform of our generation. But before we dive into the figures, I need you to stick with me because there's a crucial element hidden in this new policy that most Americans will overlook. If you collect Social Security in any form, this impacts you. If you're a retiree, someone receiving disability support, or an individual surviving on SSI, this impacts you. And even if you're not drawing benefits currently, but plan to retire within the next several years, this impacts you as well. Now, let's explore what actually happened, who championed this transformation, and why your upcoming payment may look different than you anticipate. Let's break down exactly what shifted, who advocated for it, and why this permanent increase just became our new reality. Because this wasn't some arbitrary choice. This didn't materialize out of thin air overnight. This has been developing quietly in back rooms for months, and the vast majority of citizens were completely unaware. To grasp the significance, you first need to understand how Social Security increases typically function. Each year, the government determines something known as the Cost of Living Adjustment, or COLA. It's calculated using a collection of inflation data gathered during the third quarter. When prices rise, your payments rise. When inflation slows, your payments barely budge. And for years, older Americans have protested that the formula doesn't represent the actual escalating expenses they face. The SSA has been relying on the CPIW, which tracks wage earners. Even though retirees don't purchase things the way workers do, retirees allocate more toward medications, medical appointments, heating and cooling, and housing. They allocate less toward commuting and job-related costs. But the calculation remained unchanged until this moment. According to internal documentation released yesterday evening, a rare overhaul of the measurement approach has finally received approval. And those with inside knowledge say it arrived after months of sustained pressure from senior advocacy groups, including AARP, the National Committee to Preserve Social Security and Medicare, and numerous disability rights organizations. They maintained that older Americans were getting financially squeezed while Washington talked endlessly. But things really accelerated after the mid-year inflation analysis revealed something alarming. Shelter, food, and medical treatment were increasing faster than nearly every other sector. That sparked urgent conversations inside the Social Security Administration. Leaders like SSA Commissioner Martin O'Malley, Chief Actuary Stephen Goss, and researchers from the Senate Finance Committee began re-examining the data. They compared actual spending patterns among retirees to the obsolete formula, and the findings were undeniable. In private sessions, staff members debated whether they should adopt a different inflation measure called CPIE, an index specifically created for the elderly population. That formula has been discussed for over a decade, but it never gained momentum. Lawmakers contended it would burden the government with excessive expenses. Some even suggested the trust fund couldn't sustain it. But then something unforeseen occurred. Earlier this month, an updated trustees' forecast indicated slightly better revenue than projected. Nothing earth-shattering, but sufficient to give decision-makers an opportunity. And senior advocacy groups seized the moment. They insisted that older Americans had been patient long enough. They insisted that the existing formula was antiquated. They insisted that the government bore the obligation to shield retirees from economic decline. And that's when the behind closed doors negotiations intensified. Sources indicate members of the Senate Finance Committee convened with SSA leadership in private. They examined mounting financial strain among Americans on fixed incomes. They studied documented cases of seniors cutting meals, stretching medications, and defaulting on housing payments. They analyzed disability beneficiaries who hadn't experienced meaningful increases in years. And for the first time in over a decade, there was sufficient consensus to take action. What ultimately pushed the decision across the finish line was research demonstrating that older Americans were spending up to 8% more annually than the official inflation measure indicated. That means your payment wasn't maintaining its value. Your benefits were eroding in purchasing power every single month. And according to insiders, that's precisely why the new directive was enacted. This new calculation, now quietly activated, modifies benefits using a more senior-centered measure. It assigns greater importance to medical care, housing costs, Medicare expenses, and basic necessities. And because of that recalibration, the increase becomes lasting. It's not a temporary boost. It's embedded into every payment from this moment onward. But here's where the situation gets intriguing. The SSA did not publicly disclose the precise percentage in the bulletin. They delegated it to financial experts to determine based on the new calculation. That's why there's bewilderment this morning. That's why people are waking up to conflicting information. And that's why countless older Americans are asking the identical question right now: how much more will I receive? Now, let's address the section you've been anticipating: the concrete numbers, the new totals, and which recipients gain the most from this permanent increase. According to the revised calculation, financial experts who analyzed the information overnight project that the new increase ranges between 7.4% and 8.2% for most beneficiaries. The precise amount varies by your benefit classification, but the typical adjustment settles right around 8%. And yes, this is in addition to the standard COLA you've already gotten. This is a structural, permanent increase that recalibrates your baseline payment and every future adjustment afterward. For the typical retired worker currently collecting around $1,540 monthly, this translates to a new monthly payment of roughly $1,660. That's an increase of approximately $120 every single month, or more than $1,400 annually. For someone surviving on a fixed income, that's not a minor adjustment. That's prescription money, food money, power bill money, and most critically, financial security. Now let's discuss disability payments. SSDI beneficiaries generally receive lower typical benefits than retirees, somewhere around $1,358 per month. With the new modification, the typical SSDI payment could rise to approximately $1,465. That's a significant difference for disabled workers who've been unable to keep pace with mounting expenses, particularly when rent and groceries are consuming larger portions than ever. SSI beneficiaries, who frequently face the greatest hardship, will experience a distinct calculation. Because SSI has a maximum federal payment threshold, the new increase adjusts that foundation permanently. For an individual, the maximum benefit increases from $943 to roughly $1,020. For married couples, the maximum payment climbs from $1,415 to around $1,430. Numerous SSI beneficiaries have never witnessed an increase of this magnitude in their entire lives. Survivors' payments, widows, widowers, and qualifying children also experience increases under the identical formula. A surviving spouse collecting $1,260 could now collect closer to $1,470. A low-income widow managing a loan could finally experience adequate financial breathing room to handle escalating utility expenses that have strained so many households recently. But here's the complication. Not every recipient will experience the identical percentage increase. The new calculation places additional emphasis on particular expenses, especially healthcare and shelter. That means older beneficiaries, those in expensive metropolitan areas, and those facing higher Medicare expenses may experience marginally larger adjustments. Younger beneficiaries and workers with briefer contribution histories may experience marginally smaller ones. But universally, nearly everyone experiences some degree of meaningful increase. And now let's address the timeline, because this is essential. Numerous people are already monitoring their bank accounts, questioning when the new total appears. Here's how the implementation unfolds. The new calculation is already functioning. That means the increase applies to the next complete month of distributions. If you collect Social Security on the second Wednesday rotation, your first elevated payment will land on the next distribution date. If you collect SSI, the modification applies on the first day of the month, and if you collect SSDI or survivors payments, you'll notice the increase according to your birth date-based distribution schedule. For some, this means the increase materializes sooner than expected. For others, it means you'll need to wait one additional cycle. But everyone who qualifies will see the modification appear in their account within the next 30 days. Now, let's clarify who qualifies. This section is straightforward. If you collect Social Security retirement payments, you qualify. If you collect SSDI, you qualify. If you collect SSI, you qualify. If you collect survivors payments or spousal payments, you qualify. Even if you only recently submitted your application but haven't received payment yet, you qualify the instant your first distribution is processed. And there's another consideration. If you're planning to retire this year or next year, this transformation affects your future payment. The new calculation reconfigures the foundation, meaning your starting benefit will be higher than it would have been under the previous system. This is particularly significant for individuals who have been postponing retirement to prevent losing value to inflation. Under the new structure, long-term beneficiaries receive stronger protection against mounting expenses. To make this tangible, let me share several real-world examples. A retired supermarket employee named Linda, who's been surviving on $1,530 monthly, will now witness her benefit climb to roughly $1,540. That's sufficient to stop alternating her blood pressure medication every other month. A disabled veteran named Michael, collecting $1,280 in SSDI, will now collect around $1,385. That's the difference between selecting heat or groceries during winter months. A widow named Carolyn managing a loan on survivors' payments will witness her payment climb from $1,225 to approximately $1,330. For her, that's the first genuine financial relief she's experienced since her husband's passing. These increases may appear modest on paper, but for millions of Americans surviving payment to payment, it transforms everything. But before you celebrate, there's something you must understand. With this increase comes a new collection of regulations that could influence your taxes, your Medicare costs, and even your qualification for certain assistance programs. And there's already a surge of new fraudulent schemes targeting older Americans who are uncertain about these modifications.